Hi, my name's Heather. I'm an occupational therapist, and we're going to talk a little bit about recovery after a shoulder replacement, reverse total shoulder. Afterwards, you're not able to actively move your shoulder for a certain amount of time, and so it can be hard to get dressed or get in and out of bed, position, and then we'll also address all the different little exercises and stuff that you are allowed to do. So I'm gonna start with ways to get shirts on and off. If you have an open front shirt, that is often the easiest to get on and off. But again, you can't be moving your shoulder. So if this is your affected arm, the best way to put it on is to put that side in first. If you need to lean over a little bit and let gravity kind of pull your arm away from your body, you can do that. And then you're just gonna flip it around, and then you have your open front shirt on. If you don't wear open front shirts, we'll go over an option of pulling it over your head. When you take it off, you're just gonna do reverse though. Take out your non-affected, non-surgical side first, and then you can just pull it down. So for over the head, you're pretty much gonna do the same method. You're gonna put your surgical arm in first. Again, you can lean forward, get it away from your body a little bit. Just let gravity do the moving away from your body though. And you're gonna pull it all the way on to your shoulder. And then if you can, put it over your head and then put your other arm in. And then use your non-surgical arm to straighten and pull it down. And then again, when you go to take it off, we'll do just the opposite. So get your non-surgical arm out. Bring it up over your head, and then slide it off your surgical arm. So it's very important after a shoulder replacement that you keep your arm elevated. That was gonna help the swelling, which will also help the pain and just the overall healing process. And so 45-degree angle is where you want your shoulder. So when you're sitting in a chair, you want it elevated with enough pillows so that you're up at a 45-degree angle in the shoulder. You also want them positioned so that the pillows are more supporting your elbow, your wrist, your hand, not all the way up and pushing your shoulder up even more. So also the same thing when you lay down in bed, you're gonna have your arm elevated. You don't wanna lay just totally flat. So you wanna have pillows in bed to have your shoulder at roughly a 45-degree flexion. Again, have the pillows so that they're a little bit farther down on the arm. And when you go to get out of bed, you don't want to be using your surgical arm. So you're gonna roll over on your non-surgical side and push up with the non-surgical arm in order to sit up to the edge of the bed, trying to keep your body aligned and kind of one unit as you move. So another technique after you're out of your sling to help increase your comfort and ability to sleep at night. So again, you're laying on your non-affected side or on your back, but is to take a pillow and tuck it up under your arm. And then your arm will stay away from your body a little bit. You won't be pulling it across. And the extra pillow back here will provide a little bit of cushion and support to help you sleep, improve comfort, and decrease anxiety of moving the shoulder. So after your sling is off and you're laying down, you don't have to have it up at a 45-degree angle, but having the pillow in between your arm and your body provides this little bit of cushion right here, and also keeps your arm from coming across your body. It gives it a nice, comfortable area to rest and be supported so that you can sleep better and be more comfortable. Another option, if you are unable to lay flat and you don't have a recliner, you can get a wedge instead of using a bunch of pillows. So you can get a wedge similar to this that you can put your pillow on. And then of course, you still want to either have, at the beginning, when you have your sling on, have your arm at the 45 degrees of flexion, or after you no longer need your sling, put your pillow next to you for that little added comfort and support.